Hello, my name is Nick Clausen, and I'm just posting this on the LVI forum because there's been a lot of questions and feedback in regards to Dr. Mullane's implant course, and I just want to take a few minutes and go over with you some of the advancements in technology that can make implants a little bit more predictable in the general dental office. In the past, a lot of dentists have not gotten into implant dentistry because primarily of the combination of these three reasons. One, when we place an implant, we've always had questions, what's the long-term bone health and tissue health going to be for this implant placement? The second concern has been, when I place this implant, am I assured that I have it in the exact right spot? Am I going to run into trouble? Do I have enough support, buckle with bone? Am I going to be close to a nerve? Am I going to be close to a sinus? So there's always that control factor of where the implant's placed and is it placed in the optimal position. And the third thing is profitability. Many times in implant dentistry we don't know all the restorative costs. So how do we price that to our patients? And when you combine these three factors, it's been somewhat difficult to implement implants into your practice. But today some of those things have changed. And I think technology has helped solve those problems. But just a quick update on where we're at today. 85% of the market use a hex or a screw-based systems for their implant. So what's the problem with that technology? Well, the main thing that we have is lateral forces. So there's been some independent tests done, and again, this isn't Nick Clausen's opinion or Implant Logistics. This has been independently verified, and some people will say, well, these tests are done at extreme 90-degree angles with extreme forces, but that's not the case. It was all ISO certified. It was done at a 30 degrees at approximately 100 newtons of force, which is well within the occlusal range. And what we found was that these screw-based hex systems are failing and breaking after 2 hours and 16 minutes. So that's really not acceptable in regards to strength. But more importantly, this is what some of the tests showed, but we got breakage. But more importantly, the lateral forces is most of the time, if it does not break on occlusion in the mouth, we have this little micro gap. As you can see here, this is a video of when the lateral force is applied at 90 newtons in this particular case. So you can see that little micro gap that we have, and in essence what that micro gap is creating is a bacterial pumping effect. And many of you know when you have a fracture on the tooth, what do we have? We know exactly where that bone loss is going to be. And what we're finding with these implants is that that microfracture exactly simulates a fracture in the tooth. So that's where we're going to have bone loss to that level. And it's creating tremendous problems. So this is duplicating that fracture in a tooth. And we know with implants, anytime you have a force applied, it's negative, but lateral forces make it dramatically worse for implants. And then you run into all these problems that we've dealt with in the past. So we feel that there's a solution for that, and actually the solution has been around for a bit of a time with different systems, but it's called a tapered connection. So this tapered connection was invented in Massachusetts in the late 1800s by Stephen A. Morris, and this taper is used today in a multitude of different applications, including hip surgery. It's used in Formula One cars for the highest stress points because it's the strongest connection that we have in the world. And its simplicity is in its design, and is because it's so simple. It's a true taper. There's no you don't have to have a screw. There's not a hex. There can be a hex at the bottom for orientation, but the connection is made at that taper. So this is a picture of the Exicone system, and you can see here we're applying that same lateral force, and we don't have that micrograb. So these implants do not simulate a fracture. Additionally, they're much stronger. That same test I showed you earlier with the 30-degree lateral force, this was with the Exicone system that's been around for over 15 years. And you can see here it went over 11 days with 2 million cycles compared to 2 hours with the traditional hex system. So again, its efficiency lies in its simplicity, and it's a truly strong connection. Just a quick education, because you may start to look at a few tapered systems. There's two keys for a good, strong taper. One is quite logical. The longer the taper connection, so where metal's meeting metal, if you will, the stronger the connection. The second thing is the degree of taper. So you can see here, if you could visualize, the less degree, as you can see like on the top here, 11, you can see if there's less degree, there's a stronger connection. The more degree, as you can see on the bottom, the more degree you have, the less strength we have. So when we combine these two things with the systems that are offered today, we feel, and then based on the physics, that the bottom four systems are in the physics range of having the strongest connections, and we feel that the bottom two there are the strongest connections for implants in the world. The top couple or top few are, as you can see, their length of taper and the degree are kind of outside the realm of a superior taper. So we get that microbiological seal, so we don't have that smell, we don't have that microgap created with these tapered system. So now when we have that and we have some platform switching, this is extremely important, especially in the aesthetic zone when we have subcrestal placement requirements because of uneven bone levels or potential bone level growth over the implant. So like you can see here, we may not have the problems of black triangles and exposed implants, and you can see here in this particular case there's 4 implants there. And just look at the tissue health, and here's some subcrestal placements. And again, this is with the Exicone system that's been around in Europe for over 15 years, and these are multiple years of histology here, and the clinical results are amazing. I mean, look at the tissue, and this is common practice with tapered system implants. So that overcomes one of our challenges, but technology has really helped us in the recent years in regards to placement with 3D imaging. Now we know exactly where the bone's at, where that buccal ridge is, how we need to angle that implant, how we need to avoid the nerve and sinuses and all vital structures, so we can choose the exact right diameter, length, and orientation of that implant. Then we complete a guide, a stent, a surgical stent that exactly stimulates and is stabilized in the mouth so that we can place the appropriate implant and be assured it'll be placed correctly and not have to worry about hitting a vital structure. So that has helped us tremendously. The other thing is cost control. You know, in the past with these labs, we have multiple options for restorations. The cost varies greatly, and we're never going to know that until we're done. Well, what Implant Logistics has done is partnered with some strategic partners in labs working with LVI to guarantee the cost of not only a guided system but an immediate placement implant and dentures. So what we have today is, even though we have 3D technology, that doesn't mean you have to buy it. You can outsource that. You can outsource case planning assistance that you approve off of on in the stent development. So you can see here there's a price structure for everything, including what we're going to place. So it's been a tremendous advantage for the practice to know to the penny exactly how much this is going to cost cradle to grave. So now you can actually predict your profitability and know how to exactly present it to the patient. And this includes different denture options, from uh, bar removable overdenture to simple 2 locators. So this is a tremendous asset for your practice. Now, just to summarize the two systems a little bit more, the Implant One system is $175. It's a new system. It's manufactured in the U.S. and it has a strong 6-degree taper. The Leone system, on the other hand, has been around for a long time, and this is a true taper in the sense that you can see the Implant One has a screw on the bottom, but that's just a screw to retain the system, or what we call jack out, or back that implant abutment out if you need to. But this is a true taper with a hex orientation on the bottom. It's been around for a long time. A lot of science, a lot of independent studies on this implant, and it's a 3-degree taper, and we feel it's the strongest implant in the world, and that's priced at $225. The other thing that I want to note that's been on the forum is a lot of people are like, well, this is great, but I don't have $20,000 to invest to get started with implant. And I can tell you this, those days are over, at least with Implant Logistics. We're making starter kits, and starting in 2013 to get started, that start at around $1,000 with the surgical kit. And the implants are much cheaper. Comparative implants are $400. So we're making it affordable to get into implant dentistry. So there's many permutations and combinations for those implants, for the various options that you need to do. Well, what can you do financially? Well, one of the things that I've done is I've taken, and this is important working with your practice and your team, is knowing these costs. So I've imported the fixed costs that we have here with our partners, and I put it into three different options. Non-guided, this is going to be most of your implant dentistry. Then there's guided surgeries that we're using the guided stent with the various cost and profitability that you can make, and then dentures. So, and then a summary at the end of what implant dentistry can mean to your practice. So what we're finding is, let's just take a single non-guided, the average dental office does general dentist, not specialist, that gets an implant system will average 2 to 5 implants a month. So if we just put in 3 there and you do what the industry average is and buy an implant system and you do 3 implants a month, that will average you $91,000 a year. And that's not bad, but that's not acceptable for us. What we do is we do a comprehensive training for not only yourself, but we give you the confidence to know how to place these. We focus on the key, most common types of situations that you see, and we give you the confidence to do more. Immediate extractions, when to graft, when not to graft, etc. We want to get you to approximately 15 implants a month, and that's what we're finding that we're doing. And again, most of this is still going to be our guided, our non-guided surgery. But when you have the confidence to do this, we're also going to do a handful of guided surgeries. And actually, you'll probably do more of these at first because they're so simple. So you can see just by dedicating yourself to training and fully understanding and being confident with the implant system, that can dramatically increase your revenue up to $372,000. Now, what we're finding with today's society and the aging population, and a key here I can tell you right now is team. Getting your team confident to be able to know how to present this to the patient, show them the different options, let them know what their current dentures, how they work, and how this is superior, and then suggest and show them these options all the way. And again, these you can change these prices to anything that you want. These are average prices, and these aren't out of the realm. So let's say we start presenting that, and maybe on the first year, we don't sell as many of these more expensive removable overdentures, but we start to do a lot of these locators with 2 locators. Maybe we can do one of those a month. And if we just included one of those a month, look what that adds to your bottom line. But what if your team gets really good at this and we're able to do one of these removable overdentures, we'll do one a quarter. And let's say we can get one of these fixed overdentures, every other month. So I'm putting in very small numbers here. Look what this can do to our bottom line in our practice. And not to mention just having more confidence in getting referrals possibly from some other practices to do some of these things for them, because there's gonna be hardly any pain with these guided surgeries because we're not doing flaps, etc. So even if we kept these numbers low, it can become profitable. I mean, look at what 17 implants a month could do. 5 dentures cases. So again, if anybody of you want this worksheet, I'll be more than happy to give that to you. But that's what we're shooting for. And actually, we're shooting for higher numbers for our doctors that use these systems, because when you're successful, we're successful. So you really need to commit to the comprehensive training, offer your patients the highest level of care. What would you put in your mouth? And I think when you start to look at the science of this, tapered systems are truly superior, and we can make them at an affordable price to make money for you and your practice. So again, it's simplicity, safety, versatility with reasonable pricing. So with the right implant system and methodology, we can get you predictable placement, long-term and tissue bone health, and predictable costs. So my contact information here is here, and I look forward to seeing you at an LVI course soon.